everyone. This is Ashley Hughes again with This Week in Hearing. This week, I'm really excited. We are joined by Dr. Audrey Taylor, audiologist at the University of Texas Health Science Center at Houston. Dr. Taylor will be discussing with us how to navigate graduate school and work as an audiologist with hearing loss. So thank you, Audrey. Can I ask you to first introduce yourself to our audience?
Thank you, Ashley, for having me. So I'm Audrey Taylor. I'm an audiologist down in Houston, Texas, and work out of the Texas Medical Center. I'm 3 years out post-grad. So I went to undergrad at Baylor University in Waco, did speech path for undergrad, but knew I wanted to go into audiology. And then I went to the University of Texas at Dallas and graduated in 2019 from there. I did my externship at the University of Texas Health Science Center at Houston and got asked to stay on. So I've been there for over 4 years now.
Awesome. And one thing that neither of us has mentioned that I just wanted to throw in real quick is that Audrey and I know each other from her work on the National SAA or Student Academy of Audiology board. So we're very excited to have another leader in our profession joining us this week.
Thank you.
Yeah, thank you. So Audrey, can you tell us a little bit about how you feel your hearing loss has helped you or maybe forced you to be kind of a solution seeker instead of anything else, really?
No, absolutely. It's a great question. So I'll tell you, whenever I went to grad school, there was one girl who was a year or two older than me who had unilateral hearing loss, but it had been a little while since there had been someone who had bilateral sensorineural hearing loss. And I think, during grad school, I kind of learned how to navigate, certain situations and advocating for myself and what are the things that I needed in order to do my job well. And there weren't a lot of other students with hearing loss that I knew of in the program. And so going to the American Academy of Audiology several years ago, there was a networking event for audiologists with hearing loss. And so I was excited to go to that and just kind of meet people there. And interestingly enough, there were about, I think 35 of the 40 people were students. And so, thinking about it, it's like, why don't we have a student group within the Student Academy of Audiology for students with hearing loss? And so I reached out to SAA and just kind of presented the idea to them. They liked it, ran with it. And then I got to be one of the co-founders and leaders for that student group, which is still going today. And it's just been so awesome to see all the resources that they've come up with that are available online. It talks about, applying for grad school, how to get established with the disability office, what are different accommodations that are out there that you can try requesting, how do you navigate doing word rec in clinic, just different situations, and really kind of outlining that for students. That way they have those resources and they're not trying to navigate it by themselves. And so that's something that's been really encouraging, just to see kind of that legacy left behind and how so many other students are adding to that over the years. One thing that I absolutely love about this as well is that I've been privileged enough to be the advisor for that group for the last year and going into a new year with them and just seeing how bright some of these students are and what they're doing with their, their lives and their careers. I think just this last year we had some students that were going to Boston Children's, Kaiser, UNC Chapel Hill doing research. And so it's just been so encouraging to see just coming up with one small idea and how much that can grow and just, continue to be a good thing for others moving forward.
That's awesome. And I think kind of along what you were saying, you've really created a home for students with hearing loss in our professional organization. It started off as a task force, as you remember, when you created it, and now it's a subcommittee. So it really permanently influenced our national organizations. In addition to everything that you've outlined that it does, I would say that it also helps your normal hearing peers better understand your experiences and be better allies to you. And also, it's just been amazing watching you go from the student who started this to now serving as a mentor on the SA Advisory Committee. And I love that you're continuing to stay involved and influence the future of our profession.
Thank you.
Can you tell us a little bit about how you feel you as a clinician with hearing loss can serve as an asset to the clinic, or even the other way around when it can be more difficult?
So being an asset in clinic, it's been interesting to see going from the student side of things to being on the professional side of things. And I'll tell you, I have so many patients who are so thankful whenever I disclose that I have hearing loss. It's not something that I do with every patient, but you know, sometimes I feel like that's something that can be encouraging for the patients. And seeing so many kids, we have a newborn hearing screening program within our hospital, and we'll do the diagnostic ADRs after they fail their newborn hearing screenings. And sometimes during counseling, and it's a lot to hear that your kid has hearing loss. That so many parents, they want perfect things for their child, and so being told that they have hearing loss can be sometimes hard for them to hear. And so sometimes during those conversations, I might disclose that I have hearing loss, and it's just like a look of relief on the parents' faces. And I've had several of them tell me, like, that was so encouraging that you shared that with us, because here we are thinking, this is not perfect, but then we see someone who's our doctor in front of us who has hearing loss. And, I think it just can be an encouraging thing, especially for those families that, yes, your child has hearing loss, but that's not the end of the world. And they might do some things differently, but they still have a full life ahead of themselves. Other situations where I see that's helpful is, when you have patients who are candidates for amplification, they're like, well, I'm not old enough to have hearing aids. And then I'm like, hi, like, been wearing hearing aids for over 25 years. And it's like an eye opener for them. And they realize that they don't have to be, 70 or 80 to wear hearing aids, and just how much, hearing aids have evolved over the years. And so that's been times that it's been encouraging. Burdensome per se, I think just kind of figuring out how to navigate certain things, especially, doing CI word scoring, you'll be presenting multi-talker babble in the background. And so I just learned how to kind of quickly pause the noise. That way I can hear a patient, repeat what they're saying for scoring purposes, and then just resume the noise. So I think overall I've kind of found some wiggle room and kind of ways to avoid certain situations that could be difficult, like having them wear like a connect clip or something, an ALD for transcription purposes, and just being able to hear them a little bit better with that SNR ratio.
And it's great that you're coming up with all of these ideas for ways that you can kind of navigate the clinic and make it more friendly for individuals with hearing loss, for our peers and also for your patients. Because then when they come in with questions, you might have ideas that you've had to implement for yourself.
Absolutely.
What do you think we, as your normal hearing peers, students, and audiologists alike, can do to be more supportive or better allies?
So, over the years, I've kind of learned that being an ally is something that could be really helpful. For example, I work in the medical center in Houston. We're like one of the most diverse cities in the world. And so we see so many different populations and cultures and backgrounds. And every once in a while, I'll get a voicemail that I can't understand everything that they're saying. And so, my colleague who sits next to me, she has no problem with listening to the voicemail and just kind of trying to help me navigate through the whole thing, especially if they have a foreign accent. So that's something that I'd say is encouraging. Also whenever we do condition play audiometry, since you'll have two testers, I will typically go into the booth, and then I'll have my normal hearing peer just wear my connect clip outside the booth when they're presenting. And then I don't have to look at any sort of screens and be distracted. Like I can hear them inside my hearing aid just coming through, and they'll say, presenting or something like that. That way I know whenever they're presenting certain sounds that I may not be able to hear as well. I would say those are probably the two biggest things that I've noticed. And just, being encouraging, especially to students, I would say, don't make the student with hearing loss always be the guinea pig. Or if you do get paired up with them, then, don't complain about it. I've heard some students have had some interesting situations where, their co-peers complain about like, well, testing so-and-so is going to be harder because they have hearing loss, but, we got into this field for a reason. So I just say, just treat them like you would anybody else. And unless they ask for certain things, but you don't have to advocate for them. They should learn how to advocate for themselves.
So that actually brings up another question that I'm just kind of curious about. So let's say I'm at a conference and I see that a speaker says, and I know we've all heard this, I'm not going to use the mic. My voice is loud enough. Is it inappropriate for your normal hearing peers to say something knowing that others in the room are impacted, or would you prefer to speak for yourself? Or do you think, like, what do you think is the best way to navigate that situation?
Yeah, no, absolutely. I would definitely say, hey, everyone in the room would prefer for you to use the microphone. So please make use of it. The other thing that I do like that presenters do, and this is something I learned in grad school, is repeating the question. Because
Yes.
not everybody, even those with normal hearing, could hear
That's what I was going to say. I have
Oh,
just terrible hearing and noise.
yeah,
So yeah, I think that that's a presentation technique that would be great if we saw everybody adopt. And I think you're right that we're starting to see more and more of that.
yeah.
So based on your experiences, would you encourage a patient of yours who has hearing loss if they were interested to pursue a career in audiology?
I would. Something that I've learned just in the last couple of years, even being out of school, is we have newborn hearing screenings. Like we didn't have that whenever I was born. I wasn't diagnosed till I was 4. My brother was 1, but pretty universally, newborn hearing screenings are helping identify kids a lot sooner. And I think that one thing that I've told the students is our definition of students and audiologists with hearing loss is going to be changing because of early intervention and early identification. And so I think that there's going to be more and more students with hearing loss going into the field of audiology. And I think that's something that's awesome. I think that's something that audiology as a whole is going to see more of. And I think that there's ways that we can definitely be supportive, but also know that it's not our place to confine those students and put them into certain definitions or certain boxes of hearing loss. I mean, it really is up to them to advocate for themselves in the ways that they should. But I think that we're going to be seeing so many more audiologists with hearing loss. And I think that's a great thing, especially for our profession and especially for our patients as well.
Completely agree. And I think another thing that that ties into is just the focus on diversity and inclusivity, like the broader focus on that. And that applies to a lot of populations, including individuals with hearing loss. And I feel like we're already starting to see more students with hearing loss. It's hard for me to say if there are actually more or if it's because you've created this space where now we know that there are students with hearing loss and have a community.
Yep. No, absolutely. We have done some questions on the AAA membership, and I want to say like a tenth of students now have hearing loss that are going into all the different programs across the US. And, even just having our students with hearing loss networking event at AAA every year, we usually have about 30 to 40 students. And those are just the ones that can come to the conferences. And we're seeing 20 to 30 different universities every year at least. So it's a very big, diverse group that we're starting to see more and more of.
For sure. So I'll just ask you one more question before we wrap up for today. Do you feel like the journey was worth it? And I'll just also add in one little thing. Is there anything else you want to share with us that you think we should know as your listeners?
I definitely think the journey was worth it. I think even if you're an audiologist with normal hearing, I think knowing what resources are out there for your patients who may want to get into this field and setting them up, from the get-go with that. I honestly never thought I'd be an audiologist, but God has a sense of humor. And so here I am, and it's been a wonderful journey with highs and lows. But I even met my husband out of it. So we're both audiologists. I never thought I'd meet him in grad school, but this is my profession, but this is also what I do for volunteering. And I'm just so grateful for all the relationships that I've met along the way.
Completely agree. Outside of the fact that my husband is not an audiologist, it's the community is so small that it starts out as a professional relationship and quickly these relationships change to be some of your closest friends. I'm glad that you feel the journey was worth it because I am definitely happy that you're a part of our profession and I'm so excited to see you continue to influence it and show your
Okay.
patients what they can achieve and things like that. So thank you again, Audrey, for joining us and make sure to tune in next week for This Week in Hearing.
Thanks for
Bye.
having me.